Thank you, Ken. I have another important question to ask you. Do you have any thoughts of harming yourself or others?
Oh, absolutely not. I just wish I was healthy again and be able to get on with my life.
That's great. I think it is important for you to be able to talk about your feelings. I also think it would be beneficial to talk to your doctor about your depression so we can discuss some options to help you feel better. Would you be open to possibly talking to a therapist or discussing some medications intended to help you improve your mood?
I don't know. Aren't therapists for crazy people? I'm not crazy. I just have a lot of health problems that I hate dealing with.
I don't think you're crazy at all. Therapy is actually used for all kinds of reasons. Some people find it very helpful to talk out loud about their problems. Since we're on the topic, taking care of your mental health, I noticed that you have a half smoked joint and a pipe for marijuana use. Can we talk about that?
Oh no, I forgot to put that away. Do you have to report me?
Oh, no, no. As long as you're not causing potential harm to yourself or others, what you do in your own home is up to you. My concern is that purchasing it illegally comes with certain risk, and I want to be sure you're safe.
Yeah, I'm safe. I know a guy that comes over. He's a nice guy. I'm not just smoking to get high either. I've heard medical marijuana helps with seizures, so I'm trying to see if this helps.
I'm sorry to hear that seizures are still a major concern of yours. Medical cannabis has promising implications for treating seizure activity. However, it is still harmful to smoke it, and it's important for your doctor to be aware that you're using it. You're on Keppra now. Have you had any difficulties taking it daily?
No, I guess I missed one the other day. Oh, and last weekend I ran out and I couldn't get to the pharmacy. But that wouldn't make a difference.
Well, there are labs that detect levels of different types of medications in the blood. It is used to determine if the medication is at a therapeutic or a toxic level. I have your labs, and the value is very low, which indicates that maybe you are not taking the medication as prescribed and might be the reason you're still experiencing symptoms.
That's crazy. I swear I take my meds most of the time.
Well, for these types of medications to work, it is really important for you to take as prescribed. Your brain needs a constant supply of Keppra to work and prevent seizures. So you mentioned not being able to get to the pharmacy. Is there any other reason we need to address about not taking your medications?
I don't know. Sometimes I just forget and I just don't like the way it makes me feel.
You're experiencing some adverse effects? Tell me what you feel when you take Keppra.
Well, sometimes I feel dizzy and tired, but I can't sleep and I get a lot of headaches.
Let me talk to your doctor. There are other medications that can be used to treat seizures.
I don't want other medications. I want to treat my seizures naturally with marijuana. It's legal now.
Well, its medical use is still very restricted in the state of Minnesota. And from what I do know about its medical use is that smoking it is still considered harmful. I'm very curious about this topic too, so I'm going to do more research about this topic before our next visit. Until then, I'd like you to avoid smoking it, and most importantly, I'd like you to take your medication every day. Can I set your medication out by your toaster so you can remember to take it with breakfast?
Yeah, that might help.
Okay, so goals for you is to take your Keppra every day until the next time we meet, and my goal is to get you information about the medical cannabis program in Minnesota. Deal?
Deal. Thanks for looking into the medical marijuana. I just really want to move on with my life.
And I want to work with you to make that possible.